Across the U.S., there are pockets of rebellion against public health advice like social distancing and mask wearing. The science is solid. Those behaviors help prevent the spread of COVID-19, but many people are ignoring the guidance, leading to spikes of infections. So how can officials convince people to take the disease and the advice seriously? To discuss this, we are joined by Jay Van Bavel. He's an associate professor of psychology and neuroscience at New York University. He also co-authored the paper Using Social and Behavioral Science to Support COVID-19 Pandemic Response. Professor, welcome.
Thanks for having me.
It's good to have you. In a perfect world, you tell people the facts and everyone understands and then does what they're supposed to do to stop the spread. But that's not really the case in reality, you found. So tell us, are there psychological mechanisms that are stopping people from taking the pandemic seriously? Is it just our general fatigue? Is it our spirit as Americans?
Yeah, I think the spirit of Americans is fine, and they should be capable of doing what other countries have done and doing the right thing. And many Americans are, and there's a lot of support for it. The problem is that there's also barriers that lead people to violate the guidelines and engage in risky behaviors.
Is there something about the mentality that causes us to not act in our collective best interest?
Yeah, there's a couple things. One thing that we're seeing in the United States that you're not seeing as much in other countries is the impact of polarization. So you're seeing very different responses to the pandemic playing out in Trump voting versus Democratic voting counties. And that's having a consequence in where the virus is spreading right now.
I remember listening to one economist say that if people really want to get the economy up and running again, they should be looking forward to wearing masks in public. They should be looking forward to social distancing. They should be trying to stay at home when it's not necessary, because getting the pandemic under control means that the economy can be functioning again. Is it really that it has just become this political wedge issue that has contributed to these pockets of the country and state by states having very different opinions about doing things like wearing masks and social distancing?
Yeah, unfortunately, that's become one of the biggest risk factors that we've identified in our data when we've looked at this in the United States. And you're exactly right. There's a false choice right now that's framed that it's either you care about the economy or public health. But the way that you get the economy going is by prioritizing public health. So I live in New York City, and we were hit incredibly hard. But the way that we've been able to get the economy rolling faster than a lot of places and keep it open is that we have everybody indoors pretty much everywhere in the city now wearing masks and engaging in social distancing and other activities like that.
When you were doing this study, what role did you find in public leaders having the ability to mobilize constituents, to mobilize all of us to do what we ought to be doing, and taking a more holistic approach or a more collective approach towards the coronavirus?
Yeah, the issue of leaders is really fundamental in this situation, and they have a huge impact. And you can see that play out around the world in different countries and in different states and cities. Leaders have a role in making sure that everybody feels like they have a responsibility to do what's in the best interest of everybody in the society or community. And in previous epidemics, for example, in Ebola, to deal with the spread of Ebola, they had community leaders, so these were things like religious leaders, members who were trusted in communities, reach out and spread public health messages, because that was one of the key ways to connect to local people, was get their leaders role modeling the right behaviors, sharing the public health information. And in most countries, that starts at the top. So you need everybody from your president to all the members of Senate and Congress and governors and mayors, not only saying the right things, but doing them. They are powerful role models by wearing a mask, engaging in distancing, and doing the right things in their life that signal to other people that we're all in it together.
Why has wearing masks and social distancing become a political wedge issue in the United States as opposed to in some other countries?
Yeah, so I think one of the biggest issues is obviously Donald Trump's reaction to the pandemic from the beginning was to downplay it. And he recently said that people who wear a mask were making a signal against him. And so you can look in other countries, so just cross the border north to Canada. And if you look at the expressions of this issue by leaders there, liberal and conservative, you see that pretty much everyone there has been on the same page. And then when you do surveys of Canadians, you see that they're on the same page about what to do. In the United States, you haven't seen that same response, because when one set of leaders from one party are saying one thing and another leader from another party is saying something different, people see it as a partisan issue. And this is to say that it doesn't need to be at all. It's actually a public health issue, and the virus doesn't care if you're a Republican or Democrat. Engaging in the right health behaviors protects everybody.
I think that that's part of what's so confusing for people. Why not, if you're the leader of the country? What do you have to benefit by taking a stand against masks? As a leader, I guess, in any way, in what way does that politically potentially benefit you?
I think it might be a short-term benefit, that in the short term it was a symbolic gesture. The problem, and this goes back to the economic issue, is that in the long term it harms you, because the virus is now spreading out of control, largely through the South and the Southeast of the United States, heavily in Republican districts around the country. And so they're going to be hit harder. They're going to have family members who get sick and die, and their economies and schools and places of worship are going to end up closing and be the last to open. And so as a long-term leadership strategy, it's going to be absolutely devastating. And we're starting, now that we've been through the pandemic for 3 or 4 months here, we're starting to see the consequences of that, with some places who've taken it seriously opening up, and other places now going through a second wave of closing and shutdowns, and basically taking a step backwards.
Talk to us about negative framing. That's a phrase that you use in your paper.
Yeah, so there's a lot of ways that leaders play a role in framing this issue. One is that we can frame it negatively in terms of the risks and the harm, and that's often what you see when you see the data, that you see, number of infected, number of deaths. An important element of this is also thinking about positive framing and looking at the resilience of populations in the country who've done the right thing. And as you mentioned before, some people might be feeling fatigue, but yet you have an enormous amount of cooperation and support and people rallying behind one another to make their communities and their neighborhoods safe. And so, while we want to highlight the risks for people and help them realize this risk applies to them, many people think, they might even know the risks, but think that they're exempt from them, or that they're going to end up in a best case scenario where they don't get infected. So we need to make them realize the risk, but we also need to role model and draw attention to people who are doing the right thing, and highlight and reward people who've been cooperative and are excellent role models.
In all honesty, you said some people might be fatigued. I think everyone is fatigued right now, and everyone is eager to get back to normal and have the pandemic behind us. So what do you say to people when you're trying to change their minds about taking the pandemic seriously, despite all the fatigue, despite the eagerness to celebrate summer and want to get back to work?
Yeah, so there's a lot of issues there. One is that you need to cut off people from misinformation. So there's been a lot of conspiracy theories floating around, and misinformation, especially online, spreads very rapidly, like YouTube videos that have been seen by millions of people that are essentially full of lies. So you need to help people get accurate information. In terms of sustaining their psychological resilience, it helps to understand that they have social needs, and people are feeling lonely and disconnected and anxious and stressed out. So we need to make an effort to support them. Obviously, the government has a role to play in supporting them financially so they don't have to take risks. And then finally, the other thing you can do is set positive social norms. So even if you can't get through to somebody to persuade them, if they see everybody else around them in their community, let's say at some kind of outdoor event wearing masks, they're more likely to wear a mask even if they don't agree with it, because their neighbors are doing it. And so understand that when you take those obvious efforts to engage in the right physical health activities that other people, even if they privately don't agree with you, are just slightly more likely to do it themselves when they see everybody else around them doing it. And so we have a role to play there in terms of nudging and influencing other people's behavior as well.
All right, Professor Jay Van Bavel, thank you.
Thank you for having me.